Greetings, everybody, and welcome to Fighting Malaria, Improving the Health Across Africa, hosted by the African Leaders Malaria Alliance, Comic Relief and GSK, bringing together many partners and allies from across the continent. I'm Henry Bonsu, and I'm delighted to be your moderator for this opening session. We'll be using English during this event, but we're providing simultaneous translation in French. Donc, en français, si vous préférez utiliser le service, appuyez simplement sur le bouton d'interprétation en bas de la fenêtre Zoom et vous pouvez écouter en français. C'est clair? C'est bon? Merci. Now, we've divided today's event into three parts. This first opening session will focus on political leadership and accountability. The second is a shorter deep dive discussion into some of the tangible success stories on how data is driving forward action on malaria. And the final panel will be on community engagement. Okay, the format of the opening session is as follows. First, we'll have an official welcome from the three host organizations, and that will set the scene broadly. Then we've got a panel discussion with distinguished practitioners, and they'll address the issue of leadership and accountability. That's our key theme. And finally, we'll have a Q&A where you, the participants, will be able to hold the speakers accountable yourselves. You can submit your questions from now using the Q&A function at the bottom of the Zoom window. State your name and organization, please. We want to know where you're coming from. Let us know if you want someone in particular to answer, and we'll gather up the questions and field them later in the session. Delighted to say we've got over 460 people registered. Let's hope you join us and stay with us for as much of the session and the day as you can. Now, as you know, today's event is hosted by ALMA, Comic Relief and GSK. We're going to start with some opening remarks from each of them, but first we have a message from the current chair of ALMA, His Excellency President Uhuru Kenyatta of Kenya.
Ladies and gentlemen, the fight against malaria was in 2020 threatened by the coronavirus pandemic, especially here on the African continent. The pandemic disrupted our health systems, it slowed down economic activities, and increased vulnerability for large segments of our population. Indeed, at the onset of the COVID-19 pandemic, the World Health Organization had predicted a doubling of malaria deaths in the event of severe disruptions to the distribution of insecticide-treated nets and access to anti-malarial medicines. I am, however, delighted to say that the predicted doubling in malaria deaths was averted in our African countries. Malaria deaths have been contained through door-to-door distribution of 160 million insecticide-treated nets, indoor residual spraying, and through the administration of seasonal malaria chemoprevention for children. All of this has been done while strictly adhering to all COVID-19 protocols. But the fight, ladies and gentlemen, is yet to be won. Indeed, far from it. The World Health Organization, through their World Malaria Report 2020, states that Africa continues to bear more than 90% of the global malaria burden, and that progress in reducing malaria infections and deaths has been slowed, especially in high-burden countries. We, however, are still off track in achieving the ambitious targets that we set for ourselves in the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030. The COVID-19 pandemic has demonstrated the centrality of a robust healthcare system which provides universal access to all populations. Additionally, as African nations, our social economic recovery will also depend on our ability to innovate and generate solutions to issues such as malaria, issues which have for long bedeviled us. Africa must increase their capacity for local manufacturing of malaria commodities in a similar manner that we are now producing personal protective equipment for our own use. The spread and the development of the COVID-19 vaccine and the sharing of real-time data to inform decision-making provide instructive lessons for us in our efforts to eliminate malaria by 2030. I am confident that through working together, we can do it. Let me conclude my statement by reiterating my own personal commitment to advance the malaria agenda in line with our continental commitments. Zero malaria starts with me, with you, and with all of us together. I thank you.
Thank you very much indeed, President Kenyatta, Chair of ALMA, for a very honest but also upbeat message that we can take much from as we move forward into our opening session. President Kenyatta being Chair of ALMA, I'm delighted to welcome ALMA's Executive Secretary, Joy Pumapi. Now, Joy, as co-host of today's event, it'd be good to hear what you have to say and help set the scene for us. Thank you.
Thank you so much, Henry. In 2009, the African Leaders Malaria Alliance, a coalition of African Union heads of state and government, was established, launching a coordinated and effective response to the scourge. This sustained political commitment has increased advocacy, action, resource mobilization, and enhanced accountability, as well as unprecedented partnerships in public health, which is why we're here today. The COVID-19 pandemic's destabilizing effects on global health security have negatively impacted access to essential health services, including, of course, malaria. This African CDC, which was established to detect, prevent, control, and respond quickly and effectively to disease threats, was in the early stages of fulfilling its mandate when the pandemic struck. Nevertheless, the response to COVID-19 has motivated increased behavioral and social change that will help us control this pandemic and prepare for future pandemics, protecting lives and saving communities. New collaborative models and action from the public, the private sector have seen new service delivery models developed, enhance the use of digital technology, and ensure that in just 1 year, vaccines to rid the world of this pandemic are on the market. Today, we will be discussing this unique opportunity to invest and apply lessons learned to strengthen health systems and accelerate the elimination of preventable diseases like malaria. We need to continue on the path of sustaining efforts for all the interventions mentioned by His Excellency President Kenyatta, ensuring that we are testing and treating all cases in our communities while following COVID-19 protocols and guidelines. Due to these efforts, malaria cases and deaths are still, whereas still projected to increase, are not going to double either in 2020 and must not double in 2021. The GSK Comic Relief Partnership has demonstrated how the private sector can work with development partners to support efforts by African countries to reduce the impact of malaria and strengthen health systems in several malaria endemic countries. ALMA is complementing these efforts with increased domestic resource mobilization and multi-sectoral engagement through End Malaria Councils and End Malaria funds, as well as more active engagement of young people. Defeating the malaria pandemic requires the forging of partnerships to promote advocacy, action, resource mobilization, and enhance accountability. High-level commitment from our politicians is a must. We know that when leaders commit to action, communities take ownership, sector ministries act, the private sector becomes more responsive, and partners support. So this is what we'll be discussing today. Like in any fight, not all of us will reach the finish line. So please allow me to take this opportunity to share our sorrow and offer condolences on the passing of Mrs. Joyce Kafanabo and Dr. Samuel Joanna Smith this year. The two were African pathfinders who made immense contributions to the fight against malaria and had a great service to humanity. May their souls rest in peace. Zero malaria starts with me. I thank you.
Thank you very much indeed, Joy, for those passionate words on behalf of ALMA, and you highlighted the role and the importance of partnership. So let's hear from one of the partners, your fellow co-host, Alima Shivji. Alima is Executive Director of Impact and Investment at Comic Relief and brings a lot of experience to the table as you do. Alima, let's hear what you have to say.
Thank you, Henry, and thank you, Joy, and absolutely huge thank you to everyone involved with today's event. It's a real pleasure to be here with you all. I'd also like to take this opportunity to thank President Kenyatta for sharing his thoughts with us via video. Your words are an inspiring call to action for all of us, not least the many young African leaders of tomorrow on this webinar. It's absolutely fantastic to be sharing this panel today with Jennifer Eldwa, a young scientist and campaigner from Ghana who's been leading the fight against malaria across Africa over the last year. The passion and energy of young people like Jennifer fills me with hope that we can end malaria in our lifetime. So alongside Joy and Bridget, I have the job of setting the scene for today's event, and one word comes to mind: partnership. Back in 2015, we joined forces with GSK to launch the Fighting Malaria Improving Health Partnership with one overarching goal: to support organizations embedded in local health systems to improve health outcomes and reduce the spread of malaria. And just over 5 years on, in partnership with many of you on today's webinar, we have achieved so much. Together, we've helped to build the resilience of over 13,000 frontline health workers. So when the WHO warned in April last year that COVID could lead to a doubling of malaria cases, many of those community health workers played a crucial role in averting that crisis. And through our collective efforts, over 1 million families know how to better protect themselves and their children from contracting malaria, which is a huge relief of pressure on already overburdened health systems. We worked with ALMA, the Clinton Health Access Initiative, and many others to improve the quality of malaria data so resources can better reach the right people at the right place at the right time. Today, we have the pleasure of hearing from the people who are leading this work: government officials, campaigners, health practitioners, journalists, community leaders, and more. For example, through our collaboration with Speak Up Africa, who we will hear from in our final panel, we have seen the power of grassroots activism through the Zero Malaria Starts With Me campaign. And before I finish, I wanted to make one final point on the driving force behind Comic Relief's approach to grant making. If we are able to tackle the COVID-19 pandemic and eradicate deadly endemic diseases like malaria or any of the great social challenges of our time, empowered communities must be at the heart of this effort. And one example from our partnership that really brings this point to life is from Sierra Leone, where the impact of the 2014 Ebola crisis lives in recent memory and the whole population is at risk of contracting malaria. On our radar, a wonderful organization who we'll hear from later have been training a network of community journalists to reveal stories about the impact of malaria and COVID-19 on their communities. The reporters are dispelling myths, amplifying the voice of their communities, and using their journalism to hold the local government to account. So I would encourage you all to join the final panel of the day and see some of the films that they've produced. I promise you won't be disappointed. Thank you.
Thank you, Alima. We'll take you up on that. It's a fantastic example from Sierra Leone. Okay, you did say that the partnership with GSK has been going for 5 years, fighting malaria, improving health. So let's turn to GSK. Our final co-host, Bridget Wachira, Director of Global Health there, is waiting to talk to us. Bridget.
Thank you, Henry, my co-speakers and panelists and our esteemed audience for the opportunity to share and dialogue at this event today. I only understood the true impact malaria can have, particularly on children and pregnant women, through my work in GSK over the last 20 years across Africa. and its devastating burden on families. I have also had the privilege to witness a significant effort over the last decade to ensure that the interventions and solutions we have against malaria can have an impact on relieving the affected families and communities of this burden. GSK has a strong legacy in the fight against malaria through our scientific innovation, in the development of a medicine and vaccine for malaria, and in the partnership with Comic Relief, focusing on strengthening health systems that my colleague Alima has spoken to so well. One of the medicines, tafenoquine, a single-dose cure for P-Vivax malaria, is the first new treatment in over 60 years developed for this type of relapsing malaria. GSK has developed this in partnership with the Medicines for Malaria Venture, MMV, and it marks a significant milestone towards the efforts to eliminate this type of malaria. A significant part of the burden of P-Vivax malaria is in children, and GSK is studying the use of tafenoquine in young patients. Scientific innovation, however, has little impact if it does not reach the vulnerable patients that need it the most. And our focus now with our partners MMV and PATH is on working to ensure tafenoquine can reach the patients who need it most at an affordable price. In the vaccines area, after more than 30 years of scientific work, working in collaboration with PATH and other partners, GSK developed the RTSS vaccine, the first vaccine against a parasite and the first vaccine to demonstrate efficacy against P. falciparum malaria and receive a positive review by regulatory authorities. RTSS is now being administered in routine immunization in select districts in Ghana, Malawi, and Kenya as part of the malaria vaccine implementation program coordinated by the World Health Organization. And more than 600,000 children have been vaccinated with at least one dose since the pilots began in 2019. The data generated from the malaria vaccine implementation program will inform a WHO policy recommendation anticipated later this year on the possible broader use of the RTSS vaccine, and which will further inform the Gavi board's decision on the potential procurement of the vaccine to enable access and use in other countries. If the WHO policy recommends broader use in other countries to ensure sustainability of long-term supply of the vaccine, GSK, PATH, and Bharat Biotech of India recently announced the signing of a product transfer agreement for the RTSS vaccine, and it's expected that by the latest 2029, Bharat Biotech will be the sole supplier of the RTSS vaccine, with GSK supplying the adjuvant. All interventions and solutions require a strong health system to have the desired impact. And as the COVID-19 pandemic has taught us this last year, a country's outcome is as good as the strength of its healthcare system, its political leadership, and the community's engagement. Our partnership with Comic Relief has focused on fighting malaria through improving health systems, and it has shown that investing in community health workers can have an impact against malaria. The fight against malaria is a shared responsibility, and I am motivated by the gains each of us have made, and I have faith that if each of us commit to putting our best efforts to eliminate malaria collectively as a multi-stakeholder group partnership that includes the communities we serve, we can eliminate malaria.
Thank you very much indeed, Bridget. There was a lot of drive in that, and I was really engaged. So thank you very much. I love what you said about the strong healthcare system, political leadership, and community engagement, because we've seen a variety of responses to COVID around the world, and some countries have done far better than others because each of those pillars has been working. Excellent. Thank you to you, to Alima and Joy. That sets us up very nicely for our panel discussion on political leadership and accountability, which has been referenced by you. We've got 4 panelists waiting in the wings, and in the first part of this session, they'll answer my questions, say for about half an hour. In the second, all our speakers, the 3 you've just heard from as well, will tackle the questions that have come in from you and through the Q&A button. I should say as well, when you're writing questions, make them tight, please, and have a question, not just a big, broad statement. Have a question that you want to put to somebody or the panel, please, and then we can try and meet you halfway. Our panelists then, they are Jennifer Eldua, malaria youth leader from Results UK Youth Network, Ghana. Jennifer is a lab scientist and health advocate. We also have Dr. Abdurrahman Diallo, CEO of RBM Partnership to End Malaria. He's a former Minister of Health and Health Advisor to the President of Guinea. Dr. Sabin Sanzimana, Director General of the Rwanda Biomedical Center, who's got great experience in HIV program design and implementation, and who's also an epidemiologist. And we also have, finally, Constance Njovu, Regional Coordinator of the Isdell Flowers Cross-Border Malaria Initiative. She's a member of the End Malaria Council in Zambia. Greetings, all of you. Let's see if I can see all of you. 1, 2, 3. Just waiting for our fourth person. I can see Constance there. Bridget, let's see you as well. Excellent. Oh no, Bridget, we had you before. We don't seem to see you anymore. Excellent. So my questions are going to be broken down this way. The first one is sort of targeted at all of you. And it's, how is the COVID-19 pandemic impacting the fight against malaria in Africa from a regional, national, down to a local level? I also want from you, what is one lesson we can learn from this? Let me see. Jennifer, are you, I don't see, yeah, there you are now, you've appeared. Jennifer, I'm going to start off with country perspectives. I'm going to start off with you in Ghana. Ghana's among the 15 highest burden malaria countries in the world, 3% of global cases and deaths for a country of not even 30 million. So please answer that question. How has COVID impacted the fight against malaria in Ghana? You're on mute. You need to unmute.
Okay. Thank you very much, Henry. Okay. First of all, I'd like to say that I'm honored to be here and I look forward to learning from other panelists and speakers and participants as well. The fight against COVID-19 has almost taken over everything else, especially here in Ghana. Because of the similarities and symptoms between COVID and malaria, there's a tendency for misdiagnosis when clinicians base their diagnosis only on symptoms. So that's one thing that's affecting COVID malaria management here. And also there's also been a problem, a halt in the interventions that are rolled out, such as the seasonal malaria chemo prevention and the ITN distribution and other things. Health workers also face the risk of being exposed to COVID-19 when they don't have enough PPEs. So there's a they hesitate when they have to go forward to see a malaria case. It could be malaria, it could be COVID, the symptoms are similar. So there's a hesitation. So governments need to make conscious decisions in order to nip these things in the bud, get the health workers what they need, form alliances, form collaborations with the private sector at the continental level, at the global level, in order to strengthen our health systems, especially with regards to health delivery, as that's one place that's really been affected. Thank you.
Just a quick follow-up, Jennifer. We heard earlier from President Kenyatta that the doubling in deaths has not happened. And we think that it's because of the excellent work done on the ground. Is that what you've seen in Ghana?
Well, I think that might be the case because in Ghana, although we have had problems adhering to safety precautions because everybody is in a hurry to get back to the normalcy that's happened, but with government interventions, with education, we have been adhering to safety protocols. So yes, I would say that to some extent, it's because of what has been happening on the ground, the education, provision of PPEs, even expanding testing sites all over Ghana. Now we have other testing sites for COVID across the region, across the country. So all of these have contributed to us not getting the doubling of deaths as stated by President Uhuru Kenyatta.
Thank you, Jennifer, for the moment. We're going to go across to Rwanda now, and Sabang. Just looking at the picture there, I see malaria is endemic in 11 of the 30 districts, but there are frequent outbursts in 19, and you closely link it with poverty. So how is the focus on COVID affecting your fight against the encroachment of malaria?
Thank you very much, Hanley. And it's an opportunity for us to join these panel discussions. And malaria is inevitably one important disease we all have to fight, even in a pandemic like COVID-19. So if I have to think about a few areas where fighting malaria and combating COVID at the same time has been a challenge, I'll think about prevention and community awareness. Think about how we fight COVID and all different lockdowns, restriction of movements versus malaria campaign, bringing people together that we've been doing before. You see already this big difference that we've been dealing with, redesigning the way we campaign against malaria, but at the same time, we don't expose people to COVID-19. And this is, in the beginning, the biggest challenge. So we had to work on this and make sure we do door-to-door campaigns using community health workers without necessarily bringing people together, instead reaching people at their households. And imagine the implications has been that some cost in the unit costs we're using in prevention has increased, and not only in this part of prevention, but also on diagnosis, where you have this commodity access globally has been a big challenge. A number of factories that were developing or working on the malaria commodities had to be redesigned for COVID sometimes. Sometimes also access and movements of planes and ships and supply chain really been affected seriously. And we had to work in these both fronts, fighting malaria and fighting COVID-19, plus HIV, plus tuberculosis, and others. Now, like my sister just mentioned, if you touch on the diagnosis and treatment, there's a lot of confusions that happened in the past with our clinicians, because the symptoms of COVID and malaria are quite similar. And in our context where communities and individuals have been exposed on malaria before, they would always think that, oh, it's my malaria episode, so I will get treatment. Even clinicians themselves had struggled to differentiate malaria diagnosis and management versus COVID, which is new to most of us. And if you expand it a bit on the health system in general, you see a lot of challenges, but also opportunities, because if you see how fighting COVID-19 has also somehow benefited on other diseases, on integration and also technology. We'll probably have time to speak about how we're using drones to spray against mosquitoes and larvicide programming. This technology and science speed is the best side of the number of bad things that COVID has brought to us.
Is that the lesson? Because I've been asking our speakers if they can pinpoint one lesson that's emerged from all of this. Is that what you're saying?
That will come as my first one, but also with thinking on how we've been planning for 5 years. Now with COVID, we've learned how we can actually plan for days and weeks, and speed and quick implementation and adaptations of what we do. That is maybe my second one, but technology will definitely be a driver to change how we deal with epidemics, in malaria included.
And thank you very much, Saban. So we've heard from Rwanda and Ghana. We're going to go broaden the perspective. Let's go regional now. Constance, I can see there. You're working with communities in the border regions of Angola, Namibia, Zambia, and Zimbabwe. I was looking at the map and seeing how you work and where you work. What has been the impact of COVID on your efforts and those of your, 1,500 community volunteers?
Thank you very much, Henry. And it's really good to be here. It's a great opportunity for me. Yeah, so for us who work with cross-border, it's really been a huge adverse impact in the fight against malaria. As you may know, borders closed, airports closed, and our collaborations and coordination was not as planned. So I would start by saying that most of the activities that we had planned could not take place. However, we have learned we had to move on to ensuring that we protect our volunteers, the community-based volunteers who work in communities with provision of PPEs. So here we had to spend additional funding towards that. Having said that, then we were able to continue to carry out our activities in the communities along the border areas. The communities where we work in, we're able to continue with the surveillance, and that is the community-based testing and treatment. And instead of doing it in a way that they normally do it, now they had to go to the household level to actually conduct these activities. So I will sort of just agree with what Dr. Sabini said, that most of the education, especially in communities, had to change as well. So it was not business as usual. In terms of gathering people, we were no longer doing that. And we had to modify the way of doing things. So we have changed from gathering people to having one-on-one kind of education to the communities. And of course, we have continued to work with the partners in all the interventions for malaria. So basically, we've had a real effect as cross-border organizations. So it's something that has taught us to really not stick to what we normally do, but to move on and do things differently. And what has been the lesson from all this is that we have a lot of committed volunteers, because when you look at the beginning of the pandemic, we saw that there was a lot of fear by people as well to access the health services. But with the trainings that we supported, conducted them, and talked about the COVID and how they can prevent that, they were able to now go out and educate communities and be able to continue to offer the services and to continue to educate communities in malaria. So we still managed to continue to do that despite the COVID pandemic.
Tremendous
Thank you.
Have been able to do so, given that you're working across those borders with 4 countries and with communities. I mean, I don't like the term hard to reach, but difficult to engage with for a variety of reasons, but you've managed to continue. So that's a great tribute to you and the organization. And finally then, Abdurrahman, I suppose you've got the broadest perspective as you're the CEO of RBM. What's the impact of COVID been on what you're trying to do? And what's the key lesson that emerges from that? I can see you're going to unmute it.
Yes, unmute. Okay. Thank you, Harry, and thank you and the organizers for inviting me. I think my colleagues and co-panelists here, Dr. Sabine, Constance, and Jennifer, gave very good examples of what we observed at the country level and also at the regional level and even at the cross-border level. I always say, given past experience dealing with the Ebola disease outbreak in West Africa, that it is interesting to see how a health problem can affect every single sector in a country. That's exactly what we saw with the COVID-19 pandemic. Every single sector of all countries was affected. Education was affected, transport was affected. We saw how all airlines were literally grounded or stopped for a while. The tourism sector was affected, infrastructure, pretty much everything. And the health sector obviously was also affected. We clearly saw that the COVID-19 pandemic overwhelmed health systems across the world. Major health programs, including disease prevention, diagnostic and treatment programs, were seriously disrupted because of the that global disruption that I was just mentioning, supply chains are being affected by, so the delivery of essential malaria commodities are not necessarily being available on time, and major resources just by being reoriented, being diverted towards managing the pandemic. And when I say resources, it is human resources. So human resources within the health sector and even beyond were completely taken away and sort of brought into the response against the pandemic. Financial resources, existing infrastructures, pretty much everything was sort of mobilized and completely taken away to respond to that. So we heard from President Kenyatta about WHO being concerned with that and doing the modeling, and we already heard from everyone. Thanks God, the worst case scenario was averted. So the RBM partnership and its partners worked really hard to urge countries to continue the provision of malaria services, to continue to prioritize malaria. And given the fact that the pandemic is continuing, it's not over. In fact, it's even getting worse in some situations. So we're continuously working with countries to say that it is not either or. It is not either you focus on COVID-19 or malaria. It is actually doing both at the same time and making sure that the efforts to interrupt and stop the spread of COVID-19 doesn't undermine, doesn't compromise the efforts that all the colleagues here have been mentioning.
When you say to countries, look, we think you still need to focus on malaria and don't switch your focus completely to COVID, because let's remember, malaria kills far more people in Africa and continues to do so than COVID, certainly during this first year, by a huge scale. What kind of response do you get from governments, from health ministers, when you urge them to maintain the focus or to keep the focus on malaria as well?
No, absolutely. This is actually the opportunity to once again recognize governments and congratulate them. When I say government, it's really at all levels. Yeah. Heads of state, ministers, national malaria control programs, and all the local partners and global partners, local partners, civil society organizations, everyone, they really came together and responded. And really, we saw, I mean, we heard the great examples. Countries like Benin, like Chad, Democratic Republic of Congo, Sierra Leone, pretty much most countries really positively responded and made sure that the essential of the services were provided. What we saw there was that more than 160 million of long-lasting insecticide-treated nets were distributed to households. More than 20 million children benefited from seasonal malaria chemo prevention in targeted countries. IRS campaigns were carried out. Malaria diagnostic and treatment programs were also carried out. So look, we learned this from previous situations from Ebola. We know that, and you just mentioned it, that in similar situations, in fact, the number of deaths due to malaria can augment, that can increase. That's exactly what we saw with the Ebola disease outbreak. So because of the disruptions that we mentioned, restriction, limited access to health services, but also within countries themselves, the supply chain disruptions, distributing commodities inside the countries because of the restrictive measures that were put in the context of COVID, populations being reluctant and hesitant to go to health facilities. People were running away from anyone with a white coat, basically. Yeah. So we had to act really fast. And as they said, adapted the response to the COVID-19 context, with the frontliners, people working on campaigns, getting what they need, the personal protective equipment that they needed to do their campaigns, adapting the response from mass distribution to door-to-door distribution, and some innovative ways, as we heard from Rwanda and other countries, of doing this. And I think it was mentioned. So overall services really were kept on.
Which is very good to know. I'm going to pause you for a second, Abdurrahman, because I want to remind our participants, there are many of them, I was looking 175 at the moment in the room, to remind you to keep your questions coming. We've got a number coming in already, which we can field a little bit later on after our second round of questions. Please keep your question tight and be quite specific if you can, and let us know who you would like to answer the question if you can pinpoint somebody on our panel. We're going to go to a second round of questions now before we go to the broader Q&A, which will feature everybody who's spoken so far today. Abdurrahman, I'm going to stay with you because we're going to talk about politics and accountability and what governments are doing. You've all mentioned government, or to a degree, in what you've said. Abdurrahman, I'm just wondering how the progress can be made in the fight against malaria. How can it be leveraged by African government in the battle against COVID-19 and future pandemics? Because it's all very well having experience of Ebola or malaria or COVID, but you've got to learn from it so that you benefit from those difficult experiences.
No, thank you, Harry. You just said it. It's interesting how, again, COVID-19 brought entire countries down to their knees, affecting all sectors. So it was a real wake-up call to the importance of having strong health systems and multi-sectoral approaches, basically. So clearly, the infrastructure for malaria can be leveraged to the fight against global health security threats. So investing in surveillance, like it was done for malaria, starting from the community level, community-based surveillance, where unusual events are recorded and reported, strong monitoring system through solid data infrastructure for malaria, supply chains that have been designed and implemented in a number of countries for malaria, and the deployment of trained community health workers in terms of education, awareness, and so on, all can be actually leveraged and brought to bear in the fight against global health security threats. Look, just as an example, and it was mentioned by Dr. Sabin, in the context of COVID-19 pandemic, nearly 40% of childhood fevers were just undetected. So imagine with the capacity to properly detect, diagnose, and treat those cases of fever, what that could benefit. It would definitely benefit malaria. It would also help address major killers such as pneumonia, meningitis, and so on. But it would also benefit global health threats and emerging threats such as COVID-19, Ebola, and so on and on. So from my perspective, the best preparedness against emergencies is really strengthening health system, especially at the community level, primary health care, where you have integrated package services, malaria routine programming integrated in there, and that could be leveraged. And frankly, that's the only way we can achieve universal coverage.
The relationship between the fight against various diseases and the general fight, because even here, I'm in London at the moment, and normally influenza kills between 7 and, depends on how bad the year is, 7 and 20,000 or so people a year, very, very bad year in this country. Because of the fight against COVID, there's been no influenza outbreak and almost no deaths from influenza here in this country. And it's because of that fight against COVID. And so everybody's talking about it. Okay, how do we learn from this? So obviously, when we look at the situation around the world, particularly in Africa, we have to look at those benefits, the two that come from the fight against COVID. Saban, just looking ahead to CHOGM, the Commonwealth Heads of Government in Kigali this June. I hope to join you there. But how can this summit and the Commonwealth more broadly, as well as La Francophonie, help advance the malaria fight across Africa?
Thank you, Henry. Merci beaucoup. And you're welcome to Kigali very soon. Actually, this CHOGM meeting, Heads of State has a huge task to discuss on the next phase of this pandemic fighting, but also rethinking also how our systems and our programming will be dealing with future pandemics but also dealing with the existing epidemics and pandemics such as malaria. So I see it as an opportunity, but at the same time as a challenge for these heads of states and governments who will be meeting in Kigali in June this year, especially with this malaria and NTD summit, where specifically this disease will be discussed, and expect a lot of decisions and measures that will be taken enlightened by the challenges we've faced through this COVID time, but also looking at what we missed in the past and what we can bring in now, like the element I mentioned on technology. How can we bring more technology into malaria and NTD fight, using the example of how we've brought in so short time this technology in COVID response, the examples of drones, the example of robots, the examples of other machinery and efficiencies that we've been able to put together, even in the countries with limited resources. And how do we share these experiences within our communities speaking French or English? And this should not have a limit. So I see this as a great time, 2021, and also looking at how we can be more equitable in accessing what science brings to us. Like vaccine, we know how fast that had been developed within just 12 months. But how many countries are accessing vaccines now? It's a very few countries. Now, this is inequity in access to science that this conference will probably be addressing for the next phase or next decades as we prepare our health systems to be more ready and scientists to be more connected and work together.
Tremendous, thank you, Saban. Well said, and let's hope that is prominent in the agenda in Kigali this June. Constance, what do you think we can learn from regional and cross-sectoral approaches to tackling malaria that can be replicated? Because I get the sense there is quite a bit more we can learn.
Thank you very much, Henry. Yeah, well said. Cross-sector collaboration is very key, and everyone has a role to play in the fight against malaria. So for Zambia, the president of the country himself called for the formation of the End Malaria Council and appointed the members to be part of the End Malaria Council. These were from different sectors and different backgrounds. And this included private sector, religious leaders, traditional leaders, organizations supporting malaria, government ministries such as Ministry of Finance, Ministry of Tourism, etc. And this just showed political commitment in the fight against malaria by bringing in cross-sector players who are very critical in the malaria fight. And some of the lessons that we learned from our experiences in Zambia is that using existing opportunities and the capacity to give support is increased as you draw resources from all sectors, depending on their capability. And then it's also an easy sell, as most of the times there is no need to spend any additional resources. And then we also includes the recognition of the value of the investment in malaria as it benefits the industry. When malaria is prevented, then we realize that absenteeism will be less, productivity will be increased, and then the businesses as well will benefit from this. I'll give an example of how we work as the End Malaria Council members. So at one point, the NMSC needs commodities to be transported to Northwestern Province. And we have the first Quantum Minerals, which is a mining company, which is in Northwestern Province. And they were bringing equipment to Lusaka. And of course, if they were going to return, they were going to return without anything in their trucks. But there they were, and they were able to offer that support that they can deliver the malaria commodities at no cost to Northwestern Province. The other example I'll give is for the Zambia Revenue Authority. Again, this is where we've seen that they already had paid for airtime, which is for presentation and adverts on the radio as well as television. And they offered that any member of the council where they feel that they can go and give messages, malaria messages to the communities, they were free to go and use that platform. So that platform is still open, and as members, we are all encouraged to go and do that. We have the faith leaders who have also continued to play a great role in advocacy, as well as in resource mobilization. We all know that faith leaders are actually very influential and held with great esteem at any given place in society, in any country, or in any communities. And they're able to advocate at higher level because of that influence. And this is including approaching the head of state because of that influence that they have. They can be able to do that and ask for support to fight against malaria. At the same time, they have increased the education, and this is by giving the sermons that they give every Sunday. They can add malaria messages to their sermons. And for all conferences, whether it's for the youth, for the women, or for the men, malaria is part of the agenda when they are doing that. Then as Israel Flowers, we have continued to support the cross-border communities with a very, we've continued to support the cross-border communities, and we are saying that if we are talking elimination, then definitely cross-border becomes very key. We do need to work with the neighboring countries, and this will help in reducing malaria cases, because then we won't have importation of cases, and then the local transmissions will also be reduced. So regional initiatives, like for Zambia, I can give that example. We have the Zambia-Zimbabwe initiative, the Namibia-Zimbabwe initiative, the Angola-Zambia initiative. And these are all being supported, and we facilitate the training of community-based volunteers who continue with the education of communities. They continue with the testing of the communities at community level, and they ensure that the health services are not restricted, at least within the 20 kilometers of border areas. So mostly we work in that way. I will give an example of how partners came together, and that is for Israel Flowers, Diocese of Lusaka, Masepa, ZRA. We put resources together and had this advert running, which is on COVID as well as malaria prevention. It was combined, and it has been running for some time. And this is also because of the concerted efforts and putting resources together by partners. We also put up a bill both in Livingston along the airport road. And this also is done by partners. Yes, sorry.
As we say in Ghana, to let you land. I was trying to let you land smoothly, but in the end, I had to give you a bump, okay? Because you were giving us such a comprehensive series of examples, which is great. But we want to try and move things along so we can get to the Q&A and still give our participants, who are numerous, some time. A good number of questions have come in already, and we're going to field them very shortly indeed. Finally, in this part of our discussion, to Jennifer, and it's interesting that Constance was talking about elimination. Big debate on whether or not we can eliminate, even COVID now, you know, is it suppression, mitigation? Can one get to elimination, or do we just have to live with it? Same with malaria. When we used to go to Ghana initially, I used to see my younger relatives, and they seemed to be very matter of fact. Oh, so-and-so is not well. Oh, she has malaria. And it was a very matter of fact that we just have to live with it. I'm just wondering, what is the attitude now? What role do grassroots initiatives and youth, like organizations, some of the youth that you engage with, have to play in the fight against malaria? So it isn't just something that one has to live with, but it's something that maybe one can eliminate. Jennifer.
Hello, you froze there for a moment.
Oh, sorry, I don't want to freeze. I don't want to freeze. Unfreeze, unfreeze.
Could you repeat the question?
I'm just wondering what role grassroots initiatives and indeed Africa's youth have to play in the fight against malaria, so that it's no longer seen as just something we have to live with. So-and-so is always going to get sick. Kwame will be sick. Ajwa is going to be sick. That's how it is. But it's about elimination. What role do grassroots initiatives have in this fight against malaria?
Okay, thank you for that. Let me begin by saying that for today's leaders, it may be too late to see the end of the malaria fight, but for us young people, it's only the beginning. So I'm going to answer this by sharing things that we or I have done as a youth leader for health. So at my region, in my country, Ghana, in my region, I have met with the Regional Director of Health Services, the Regional Malaria Focal Person, the Regional Deputy Director of Public Health to get the malaria conversation going, especially in this time where COVID is taking over everything. I meet with them, I have spoken to them, I'm letting them know that they have set these targets. This is the picture of malaria in my community, in my region, and those are the targets they have set. What can I do to help? Where have they reached? How can they get to their next level? To sort of hold them accountable really as to the things that are happening with regards to malaria. In my country also, there's been a long-standing issue of this malaria fund, a 0.5% common fund that is allocated for malaria activities. But in recent years, the money has not been disbursed or used for malaria activities as it was meant to be. So in my community, in my region, I paid a visit to the municipal coordinating director to formally petition him to find out what is happening with that fund that is meant for malaria activities, to let him know that there are issues surrounding it. We are aware of it. We want to know what is happening. So when they have their stakeholder meetings, when they meet, they know that they have to look at this issue. It's not something that can be ignored. They have to look at the issue. They have to come and account to the people because it's for malaria activities. And also because of the COVID-19 pandemic, a lot of our advocacy strategies have moved online, specifically to Twitter. We've taken advantage of key advocacy moments. Last year, International Youth Day, Commonwealth Health Ministers meeting, World Malaria Day, and just last week, Valentine's Day, we had a Twitter storm. We put out our messages. We were tagging people. We have people of note reacting to our messages like Raj Punjabi, and one of our panelists here, Dr. Diallo, also reacted to our message. So thank you very much, Doctor. And yes, so we are hoping to get our message out like that. Last year, again, in December was our election year in Ghana. So that's another way that you can push your message. As young people, for me, I took the advantage to write a letter in my capacity as a youth leader for health, to write an article, sorry. It was published in arguably Ghana's #1 newspaper in the politics section, so that the politicians can see that we are calling on them to involve youth, to prioritize health system strengthening when they are in power. And I'd like to say that with all these things that we are doing, it's important to look at things that can also get us there, things that can make us successful. One of those things is for us to have a seat at the decision-making table as young people in Africa. We need to have a seat. That is why I am so happy that His Excellency President Uhuru Kenyatta, the current chair of ALMA, has prioritized youth engagement in the fight against malaria. That's something that's very important to us. We voice, and we are glad that he is giving us that opportunity. And also, I'd like to call on my peers to use whatever they have, whatever skills they have, whether it's being a health worker, I'm a health worker, or educating your community on the importance of using insecticide-treated nets, or whatever you have to offer in the fight against malaria. It's important to also spend time learning as an advocate. It's important to have leaders, mentors, teachers, and you need to spend time in deliberate practice as a youth initiative to get your message down, get it tight, and go to the right people. To cap it up, I would say the power you have within you is the most important thing that you could possess. If you learn to harness it, there's nothing that you cannot achieve when you use the power within you. Thank you.
Oh, fantastic, Jennifer. I think I thought for a second I dropped into some motivational speech. Motivational, that was great. Thank you very much. It's like a motivational, like a televangelist or something, very powerful. It got quite spiritual in the end, but it's very true what you said. Right, okay, so we've finished our 2 key rounds of questions. I want to bring back our earlier speakers from our partner organization. So let's bring back Joy Pumapi from ALMA, Alima Shijvi from Comic Relief, and Bridget Wachira from GSK. Let's see, I can see Alima. There we go, let's wave there. You're good, you're there. Joy is back and Bridget. Fantastic, okay. I'm glad we've got an expanded panel because quite a number of questions have come in. If your question isn't immediately, or the thrust of your question isn't immediately apparent to me, I may have to reframe it. I'm just saying this to all the participants out there. No insult intended, but just for brevity and clarity. So lots of you have filed in your messages, and I'm going to try and target them at people. So thank you very much, Ruben from Zambia. I'm going to slightly reframe your question, Ruben. I'm going to put it to Constance, who's in Zambia. So let me say this, Constance. I mean, how has Zambia strengthened malaria programming with setting up mechanisms like End Malaria Councils to increase accountability? Otherwise, so I can put it the other way, have these End Malaria Councils help to increase accountability when it comes to the tackling of malaria? To Constance, yeah.
Thank you very much, Henry, for that question. Yeah, so for the program, we have developed an accountability mechanism, and this is with the End Malaria Council. So there's the use of the scorecard, and this is used at all levels, national, provincial, as well as district level. So this scorecard, and I am not sure if you know how it works, but it's sort of like a management tool that sort of shows where you are in terms of activities, what has been achieved, and whether you are in progress. And also you have to explain why certain activities haven't been done. So the scorecard actually is the mechanism that is we are using for mechanism and accountability, rather for the accountability.
And have you seen a response to the use of the scorecard? Does it have an impact?
It does have a great impact, definitely. What we have seen is when you see that there is rate, and meaning that maybe the implementation of that activity is not being implemented in time, then you're able to see immediately and you address that immediately. So there's correction which is done immediately because you are able to note as you look at the scorecard. So it's very easy to actually see whether you are progressing well or not, because you are able to actually follow looking at the number of activities where you are lacking or where you are slacking. So it sort of helps you to actually move forward and ensure that you achieve what you have actually planned. So we use that. Yeah. Thank you.
Thank you very much indeed. I'm going to jump straight into the next person because quite a few are coming in. This one's from Manuel, who's in Puerto Rico. Hello, Puerto Rico. And he's a public health entomologist with extensive work in Africa. And the question is, how do we increase interest and participation on vector surveillance at undergraduate and graduate level to assist in the implementation of integrated vector control efforts beyond the use of nets and indoor residual spraying? So I'm going to, okay. The person who's probably graduated most recently is, let's see, Jennifer. Do you have a thought on that? And if anybody wants to jump in after Jennifer's spoken, then please just signal to me. Okay, Jennifer, what do you think of that question there? What's your response?
Right, I think in order to increase interest in these things at our university level, a lot of education has to go into these things. A lot of We need to see people who have made it in those fields. I'm talking as a young person. We need to see the achievements that these people have made in these fields, so we know that this is the contribution that it makes to this target. We need to know that it's not just courses that is introduced, but it's something that's actually contributing to national development, to Africa's development. So by making it appealing to people, by introducing other professionals in this field who can talk to our young people. In Ghana, we have something called STEM. That's science and technology, mathematics, English. So we have mentors who talk to young people about math, science, especially young girls in senior high school. So something similar could be done where you have mentors to talk to younger people about the importance of having these things and where it gets you to.
All right.
Yes. Thank you.
Okay. So who else wants to address that? Vector surveillance, mentors, advocates. Abdurrahman.
No, I just totally agree with Jennifer. I just wanted to jump in there. There's been experience in the past in formalizing in-service training by adding it to formal education, undergrad or grad school. So considering that this is a multi-sectoral discussion, usually it's not the students that is a problem, but it's the departments, the ministries that are involved that have to make that decision. In this particular case, it is the Ministry of Health, it is the Ministry of Higher Education that are involved. So it takes some advocacy work, some coordination between national malaria control programs that would sort of lead this battle and bringing different ministries together to discuss this, work on it, establish a plan, because you would have to see how that would fit into the existing program. What are the learning objectives? At what level, the continuum of program, where you start, where you end. So it takes some planning to do that. And I just want to link this to the previous discussion. End malaria councils can easily be a very good starting point for such a discussion, because in end malaria councils, you have multi-sectoral representation, ideally from the Ministry of Health, Ministry of Education, and some other relevant departments.
Abdurrahman, thank you very much. And we've got a series of questions, a storm of questions from Isaac, who wants to know, first of all, from Jennifer, what are the key decisions that government took to mitigate the impact of COVID on malaria programs? And you can answer briefly, Jennifer, because I want to try and get through a few more. I mean, if this is something that you want to deal with. Mute, you're muted. Mute, unmute.
Yes, sorry. Okay, so in Ghana, we have had several interventions at our hospitals to ensure that we don't lose any malaria cases or COVID-19 cases by having triage teams, because we don't want anybody to feel like they cannot come to the hospital because of what is happening with COVID-19. We have systems where somebody comes in and then they are screened, they are spoken to. We have psychosocial counseling and all of that, so that we do not have people feeling stigmatized if they should have anything. We open it up to everybody. If anything should happen, if you are screened and then you are found to have whether COVID, because everybody is screened for COVID, then you go through psychosocial support. You're giving the right kind of support and shown the right way to go so that you get the treatment that best suits the reason that you came in, especially for malaria. And there hasn't also been any reduction in interventions. We still have drugs for malaria treatment. We still have testing. RDTs are available. Malaria microscopy is still going on. And yes, there are still other means of having distribution of insecticide-treated nets despite the COVID-19 pandemic and restrictions like that. So yes, thank you.
Thank you very much. And let me see who else might want to answer that. Saban, would you want to answer that, government decisions, etc.?
Sure. Thank you very much. These are very good questions. I think one of the things the government should be doing now to make sure we fight all diseases at the same time is to look at how these are integrated at the community and health centers levels. The element of diagnosis is very critical. These two diseases, COVID and malaria, have rapid diagnostic tests. So availing these tools, these rapid tests at that level will be very helpful, even for community health workers, like the case of Rwanda, who are treating people. Almost 60% of malaria cases in Rwanda are managed by community health workers. So what we're doing now is to make sure they also be able to test for COVID-19. So someone coming with fever or malaria kind of symptoms, yet could be COVID symptoms, can be managed on both sides. So that will also help those providers to be comfortable having PPEs, having rapid tests, and also clients to not confuse those diseases, as I said earlier. There's something I want also to add on the previous question about students and university graduates who may be playing a role in programs. So maybe a short example experience of what we started 2 years ago with our malaria program in the University of Rwanda. So before student medical or related fields are finishing their studies, they're invited to contribute in program interventions on field. So they're helping even in COVID now. They've been helping the past 1 year in testing, in prevention activities, in all public health measures. And now as they graduate, they're already knowing what is happening in implementation, including in malaria control programs. So we've seen this as a really a big change, a big shift, and both beneficial on the side of programs, because we're getting people who are helping us, but they're learning at the same time. In the time they join us in the service, there's no 1 year or 2 years to prepare because it's already prepared. So we're expanding that on the side of research so that they get research projects or some topics for their thesis so they can implement, supported by a program people. And that helps also for their academic work.
Excellent, Saban. Win-win there. Okay, we're going to move on to another question. This is from Anna Gia, who asks whether helping communities or sectors respond to a new disease, i.e. COVID-19, change how they receive information and interventions for the old disease, i.e. malaria? And was it possible to change perceptions of business as usual in malaria for the better by also addressing COVID? Well, I think that's sort of been answered in some of our previous responses, but Joy, I don't think you've had the chance to address that directly. So what would you say to Anna there? Because it's a really interesting question.
It is absolutely, and it's a very important one because pandemics are behavioral change challenges. And one of the areas that we consistently neglect in a pandemic such as this is that modifying behavioral human behavior requires a different group of scientists, that is, social anthropologists and behavioral change experts. And we tend not to engage them in this. And I think it's one of the key drivers of failure to comply, even with some simple requirements like wearing masks. So I think though that there is a synergy here when you look at the type of, if you have community health workers who have received the right type of training, because one of the important areas for community health workers is behavior, changing behavior, so that if they have that type of training, then they will be able to combine behavioral change strategies for malaria and for HIV/AIDS and with those for COVID. But if they haven't, then it's a golden opportunity for us once and for all to address this deficiency and ensure that behavioral change is part of community health workers' expertise.
Excellent. Okay, Abdurrahman, please keep it brief if you don't mind, because we've got quite a lot of questions coming in. Please, yes.
Yes, I'm just so happy and impressed by my sister Joy's response. So we just wanted to second what she said, because she just mentioned an important category of professionals that are very important in this process is social anthropologists. In fact, the fight against Ebola, it was a turning point. You could have the best epidemiologists, the best doctors, the best lab specialists. Actually, we learned that without social anthropologists, we couldn't make a difference, because you have to understand how the populations behave, what is keeping them from seeking care, what is actually driving the way they respond. If you don't know what the fear of people having their relative taken away from them, not them seeing the relative being buried, or why they're rejecting black body bags and so on and on, you're not going to be able to address their immediate needs. So it's a very important point.
Yeah, social anthropologists are often maligned or marginalized, so it's good to kind of like give them the credit where it's due. Now, this person is anonymous, wanting to know, Bridget, I think you addressed this a little bit earlier, are there any vaccines for malaria in research? Bridget.
So as I'd mentioned earlier, after 30 years of research in this area, GSK together with the MMV developed the first vaccine against a parasite. And this was the vaccine RTSS against falciparum malaria. The focus at the moment is on the malaria vaccine implementation pilot currently ongoing in Ghana, Malawi, and Kenya. And we anticipate that later this year, the results of that pilot will inform the decision by the World Health Organization as to the possible use of the vaccine, the broader use of the vaccine. And should the recommendation policy be made by WHO, then we expect that the board of the Gavi Alliance will make a decision with respect to procurement, and more countries can then have access to the vaccine. As we continue to generate more evidence, and we gather, and certainly if there's one part of scientific innovation that has truly accelerated in the COVID pandemic, has been the speed at which when you have scientific collaboration and significant resources, COVID vaccines have been developed from development to registration. That is a phenomenal scientific achievement, which we are hoping that we can use those gains and those learnings to address future research, and hopefully that will include malaria in the future.
Well, that's tremendous, because I think our anonymous attendee has got a couple of supplementaries asking what are possible technologies that can be put together to target malaria. And then this one is the fight against malaria disproportionately targeted against the different parasites based on their infectivity rate, like falciparum versus vivax. Any thoughts on that, Bridget, at all?
Can reveal, but I think the burden, in my view, is proportionate. So, for example, in sub-Saharan Africa, the largest burden of malaria is P. falciparum malaria, and why the efforts are targeted towards that. And we know that there are certain other countries where P. vivax malaria is endemic, for example, the Horn of Africa, or in the Amazon in Brazil. So I believe the efforts are targeted towards where the burden of disease is on the basis of the different types of parasites. But I'm sure my colleagues, especially Dr. Diallo, can give further comments on whether we feel that the efforts are proportional to the burden of disease we see.
Dr. Diallo is shaking his head, okay. Right, fantastic. This has come in, it's a very brief question from Annette Hornung-Pickett. Annette asks, will you have synergies to NTDs? Now, this is interesting because only a few weeks ago, the WHO, Dr. Tedros, and his team launched a new roadmap, 2021 to 2030, for the fight against NTDs, neglected tropical diseases. So I suppose the question out of that is, with all the focus on COVID and of course today malaria, how does one also embrace the fight against neglected tropical diseases, which, as we know, really damage the lives of so many people, and they don't have so much attention, hence neglected. I'm looking at Alima. You're looking like you're shaping to answer, so I'll go to you, Alima.
I wasn't, but I'm absolutely happy to give it a go. I think one of the biggest things that we learned in this 5-year partnership was the importance of health system strengthening. Bridget's mentioned it. I think Dr. Diallo mentioned it earlier. It's come across some other speakers. Health system strengthening is really, really important. And when you strengthen health systems, they can then be strengthened against lots of different diseases and conditions. So I think that's probably part of the answer, is really looking, that there is a value to putting disease-specific funding in place. There's a much bigger value of that being done within a context of strengthening health systems and investing in all the partners that make up a health system. So hopefully that's a starter of an answer, and I'm sure I've got colleagues that can complete that.
Who else could join in on this one? Saban, do you want to join in this? Because really we're thinking about tackling NTDs and malaria together, how both communities could work together. What would you say, Saban?
I would say something I actually thought about for many years in my previous work when I was head of HIV program in Rwanda for almost 10 years. I was thinking about how can we learn from experiences in different programs, HIV, malaria, tuberculosis, and come together to a plan or a roadmap or something that can benefit all these programs. Because you look at how we address HIV, address malaria, and how we address NTDs. You see a lot of success from each of the programs. But again, on each program, there are also some areas to improve, some weaknesses. So maybe working on those areas that we are not performing well on different vertical programs, we could come up with something really, really great. And NTDs is one of the examples that it should be neglected. It should be something that we look at it as a priority program because it affects everything. Whatever affects one program, one disease, it's just one patient, it's one person. So maybe it's looking at how we look at this forward. We try to do some steps here in Rwanda by putting all programs together under one board, which is Rwanda Biomedical Center. But in one step, now we're moving into from the access to service into quality of services and other diseases that we didn't address properly. NTD is one, hepatitis is another one, maybe more other diseases and more epidemics to be prepared for.
How high do you think NTDs will be on the forthcoming Commonwealth Heads of Government in Kigali? Will it feature?
Absolutely, absolutely. And there's a specific summit, I think Dr. Diallo knows about it and other panelists here. We're preparing about it and we make sure it is not neglected at all. It becomes on the top of the agenda. I think different heads of state will be talking about it and other people who have some work to push on the agenda. So it will be a priority for sure.
Anybody else wants to jump in on that? Let's see. Okay, yeah, Joy.
Yeah, not on the summit, which we are very thankful to Rwanda for hosting and for agreeing to have the summit on malaria and neglected tropical diseases. But what I wanted to add is that, appreciating that like malaria, NTDs are diseases of the poor, and the debilitating effect that they have on the livelihoods of the poor in our communities, and including food and agricultural production and the ability of children to learn in schools, just like malaria does. We actually have started working with countries and the NTD community on developing scorecards country by country for monitoring progress on the fight against NTDs and identifying the bottlenecks. And we have worked with a few countries already on the continent to do this, and it is actually proving to be a pretty successful approach. And it is also bringing the attention of the heads of state to the NTD agenda. But they are an extremely important agenda. They are preventable and they are curable. And we really should have no excuse to be continuing to have NTDs on the continent.
Tremendous. Thank you very much, Joy. And then we have Chezi Voma, who's asking whether malaria testing is being made more affordable and accessible. If yes, expand on how it's made for citizens to test themselves and get the right treatment immediately without delay. Who could answer that one? Malaria testing being made more affordable and accessible. Accessibility of malaria testing. I'm looking at all of you. I see a sea of blank faces. Let's have a look. Who? Abdurrahman, yes? Is that? Or?
Yes, I think there are different parts to that question, but roughly, for what I know, in most countries, malaria is considered as a priority program. So many governments made the decision to offer basic components of malaria prevention, diagnostic, and treatment free of charge to the population. Obviously, there's always a cost attached to making those products available. But technically, testing using the rapid diagnostic test and accessing the medicine, obviously accessing all the prevention commodities is made free to the populations in many countries. The challenge there is just expanding those services, the access to cover all parts of the same country. There is a physical barrier challenge there, and obviously when there are also limitations in resources and supports available to countries, there is a gap that needs to be filled there.
Tremendous. Thank you very much, Abdurrahman. And with another question here about what the youth can do internationally to help in the fight against malaria. And that obviously has to go to Jennifer. What do you think? What can young people do to best help? I suppose there are you part of an army? I'm being told that there is a youth army. Is that right?
No, that's the Alma Youth Army, but I'm part of the Youth Leaders for Health program. Right. Yeah, with Results UK. Right.
Okay. And so, but briefly in response to that question, what can young people do internationally to best help in the fight against malaria?
All right. So again, I come back to the Youth Leaders for Health program. It's 3 countries that have come together: Sierra Leone, Tanzania, and Ghana. So we are not only working in our various countries, our countries, but we are coming together to work at the international or global level as well. In January, we had an engagement with the African Union. We met the deputy chairperson of the African Union, and then we talked about, we presented a communique to him about the youth's willingness to be engaged in health decision making. So he promised to forward that letter at the engagement at the African Union. So we are putting ourselves on the map. We are letting people know that the youth are very important, and we need to have a table at the decision. We need to have a seat at the decision making table. So at so collectively, all 3 countries, that's one of the things that we have done. We take advantage of every international meeting, whether it's online or in person, to send communiques, to use Twitter, to get the attention of the people who are meeting, to get the attention of the organization, to put across our messages as Youth Leaders for Health. And I think that's something that all youth initiatives can do in this COVID-19 era. It's not an excuse. You can still use social media. You can find allies who can help you to have a moment at those international meetings, have a moment at those key advocacy moments to talk about what you can offer as a young person, what the youth need to develop, and how we can be a healthier country. Yes.
Very good. Thank you, Jennifer. I want to go to Joy again. You may have something to say about the Alma Youth Army, which I hadn't heard of until very recently. And then also, I mean, I suppose there's a follow-up on this one. Given the success of the national and subnational scorecards for malaria and NTDs, etc., have any countries expressed a desire to include any COVID-19 related components to their scorecards? That would be the supplementary. But first of all, the Alma Youth Army.
The Alma Youth Army has just been launched, which is just a few weeks ago, by His Excellency President Kenyatta. That is at the time of the AU Summit. This year they had a virtual summit. And so it is in the process of forming. And our hope is that as it forms, we will have champions like Jennifer and the organizations that they are associated with, because the idea is to try and get all the youth health organizations engaged in the fight against malaria. And there's tons of, that you can do. Young people, are the drivers of technology. And there are massive influencers, whether it comes to resource mobilization, whether it becomes to turning the tables on technology transfer and technology platforms and revolutionizing manufacturing on the African continent. So there are a lot of pathways that young people can follow in the fight against malaria and link it to other health sectors. But I think it's a massive opportunity for us. We are a young continent, and there's a huge brain pool here that needs to be tapped. Right. And whether you are in Africa or outside, I think it can be done.
Tremendous. And then the follow-up here was about scorecards, and have any countries expressed a desire to include any COVID-19 related components to their scorecards?
I have not, my team has not raised that issue. Yeah. But definitely there has been concerns about the symptoms, the closeness of the symptoms between malaria and COVID, and how you are going to actually differentiate the two or make the tools available at particularly at community level and at a small health facility level to differentiate between the two. And I think what Rwanda is proposing, having test kits for COVID at community level, is going to be extremely useful, because that serves as a way that you can actually solve that particular problem and also incorporate it into the quality of care. In terms of the community scorecards, we focus primarily on quality of care and effectiveness of interaction with the community. And one of the countries where we have quality of care community scorecards is countries like Ghana. And these are the type of issues that could be resolved through bottleneck analysis, but by making both test kits available. So I'm very happy for Dr. Sabin's contribution on this. But it is a very, very important question. I think it's a huge opportunity for us to integrate more comprehensive disease and pandemic management into the scorecards.
Very good, thank you, Joy. I'm gonna go to Alima, because I've got a question here. This person's anonymous. Will GSK and Comic Relief continue this amazing journey, because COVID was not factored in and now there is danger of losing all gains? Alima, what do you think? Amazing journey, but there are dangers.
It is absolutely an amazing journey, but for us at Comic Relief, this journey didn't start just 5 years ago. So it's been 3 decades that we've been funding work on malaria in Africa, and this is a priority area that we will continue to focus on. One of our other partnerships, which is with the Global Fund to fight AIDS, TB, and malaria, and the Bill and Melinda Gates Foundation, is looking specifically at the response to COVID-19 and its impact on malaria and other infectious diseases. And in Africa, that includes Zimbabwe and Uganda. And that's work, for example, that continues into 2023. So I absolutely agree, we cannot lose the gains. And in fact, if anything, we need to make sure we're leaning into the learnings from COVID as we continue to invest in malaria.
Let me ask the other half of that partnership. Bridget, what about you from the GSK point of view about this partnership and moving forward?
I think Alima has described it. Our belief as GSK is that we are at the moment in time where partnerships both are critical to delivering every gains. It is extremely difficult for any single entity or individual to be able to make and sustain the gains we have made. And it is our commitment to continue to find the collaboration and partnerships where we can best deliver our expertise and support synergistically partners, support and deliver continuous interventions. We each come with a strength, and I think our role is to find ways in which we amplify each of our strengths rather than try to do and leave each to and support each other to do their best work. So we believe partnerships is the only way to sustainably sustain the gains.
Excellent, thank you, Bridget. And we've got this one from Samuel, who's in Cameroon. He says, I've noticed in my country an increased use of anti-malarial medication because of COVID-19. Has anyone else seen a similar trend? What can we do to reduce the development of resistance? That's from Samuel in Cameroon. Who would want to take that? Abdurrahman, what do you think? Is that something for you?
So sorry, can you come back on the question, Ari?
So the question is from Samuel in Cameroon. He says he's noticed an increased use of anti-malarial medication because of COVID-19. Has anyone, I mean, that's maybe not least because of the kind of stuff that was being said by Trump, and, among other things, last year. Has anyone seen a similar trend, and what can we do to reduce the development of resistance, says Samuel?
Yes, I mean, I can take a crack at the question. Maybe others can add, because there is no. So we observe this, and this comes from everything that we all heard at the beginning of the pandemic about hydroxychloroquine and other malaria-related products. We saw actually protocols being implemented officially in countries. The protocols made of hydroxychloroquine, azithromycin, and zinc, and other things. And then also we saw people actually rushing to pharmacies, to streets, individually, just deciding to take products, whether they've seen a doctor or not. In fact, it goes back to what we were saying earlier, management of fever or any symptoms. Anyone with the smallest feeling would just run down the street and do this, not to mention the increase of substandard, counterfeit, and fake products disseminated in markets, labeled as malaria products, that people rushed towards it and started taking. So with all the consequences that we can have that could result from that, misdiagnosis, death, and everything else, that resistance and everything that we know. Look, I think one of the ways of addressing this is continuously raising awareness, educating, sensibilizing the population, and also having local authorities, local governments and agencies play the role of clearly explaining what is official treatment guidelines, what are the official measures that are in place, what should be done, what cannot be done. But that's a continuous process. Anyways, the use of substandard and counterfeit drugs in Africa is a major problem outside of this context, but with this context, huge problem.
It is indeed.
Maybe others can add.
Our final question from the floor, this is to Saban. How can we engage governments and control programs to integrate new tools in their everyday malaria control activities? So persuading decision makers at the top, ministers, governments, to integrate new tools in the everyday malaria. I mean, it's probably easy for you because obviously you have a government that's very, very keen. President Kagame and his team, I think they're very behind you. But I mean, how does one more generally, because it's not always the case in every country.
Great. Yeah, you're right. I work for the government, but also I'm a scientist in my other capacity. I think that the best way to create those tools is start from the science, from the innovation, and how researchers in the countries and whoever has an idea to contribute is brought on board from the beginning, instead of bringing it when the product is just fine. Maybe it's even hard to convince it to talk to the government. So I think with the experience already mentioned from having university researchers already engaged in contributing to the government work, students before they graduate also join the different program implementation, has been one of the best tips and tools that helps to even advance and even propose something, because you're already working together. So when I go to teach epidemiology at University of Rwanda, it's always easier for me to bring an idea or something to the Rwanda Medical Center where I'm fully engaged. So this connection of academia and implementation, probably something we should emphasize more and try more in our context.
Yeah, very good. Thank you, Saban. And I'm going to wrap up with that question, really. I'm just going to go around and try to get you to think about political leadership and the importance of it in your work and in your attempt to push back against malaria. Constance, I mean, working in Zambia and of course across those borderline countries, how critical is it to get the political leadership to, I suppose, buy in to the importance of this struggle against malaria, especially at a time of COVID? How successful have you been, would you say, Constance?
Thank you very much, Henry. I think for Zambia, we have been very privileged because we have leadership that is really, really very supportive. The political will is there, starting from the head of state and going to our Ministry of Health. They are all very, very much engaged. And this is why we see that for Zambia, malaria becomes the first priority in everything that they plan. So it's top of the agenda for the country. And what we have seen is that wherever we need their support, when we have activities that we are doing, they are always there to give us that support. And yes, we've never had any problem or any challenges to get them to get down to where we are doing any activities. Thank you.
So Constance is knocking at an open door in Zambia and partner countries. What about in Accra, Jennifer? When you're knocking at the door of State House or Jubilee House, is it an open door when you raise the issue of malaria and the concerns you have? Jennifer appears to have frozen. Ah, you're back.
I'm sorry, Henry, could you repeat that?
So I was just saying, Constance is knocking at an open door in Zambia. The political leadership is behind her fight against malaria. How far would you say the political support is coming from the government in Accra? I mean, or do you need more from them, or are you getting what you need?
Well, Henry, like Oliver Twist would say, we would ask for more. There are lots of things going on already. Yes, they are open to us. It's difficult to get meetings with them, but they are open to us when we present our
Jennifer, you're
asks, especially.
Jennifer, repeat the last sentence because you broke up.
All right. I'm saying that the government of Ghana is very open to increasing or going on with the fight against malaria. Can you hear me now?
Yeah, it's just that you're breaking.
So yes,
one more time.
And especially, oh, I'm so sorry. Yes, so the government of Ghana is very open, but we continue to ask for more from them. We continue to impress upon these domestic funding. We use every...
Yeah, I think, Jennifer, we're going to have to...
Especially as we are working with...
Sorry, Jennifer, your line's broken up so much now, but I think we get the drift. So thank you very much indeed. And just to wrap up then, political leadership.
Okay.
Dr. Diallo, of course, you advised the president of Guinea. Are leaders getting it? What more do we need from them?
Very good question. We've seen great leadership, as we all say, that throughout 2020 in terms of heads of states prioritizing malaria. We really would like to build on that to see a commitment to increase and sustain domestic resource mobilization for funding malaria throughout 2021. As we always said, that it is not either or, it is both COVID-19 and malaria. And I just would like to take this opportunity to acknowledge President Kenyatta's leadership ever since he took on the chairmanship of ALMA. We've met with him a few times. He's demonstrated great leadership, touching on actually all key points that we covered here that are all needed to sustain the fight against malaria, involving youth, working at the regional level, data and encouraging the establishment in malaria, funds to encourage domestic resource mobilization. And just linking that to the global effort that we do in working through regional economic communities to mainstream the fight against malaria at that level. So really excellent leadership. We would like to see that continue.
Excellent. Thank you, Abdurrahman. Closing thoughts from our three partners, our hosts today. First of all, Bridget, your closing thoughts, please. I want you to send us into the break with enthusiasm and determination and alliance, partnership. Your thoughts, please.
Yeah. And my thoughts would echo right from what the question you've asked around political leadership. I think I really have faith and I have hope, and that has come really from the experience of COVID-19. I think my reflection of political leadership, especially of the African Union in COVID-19 has been, I think it was the first time we were in a situation, political leaders in Africa were in a situation where, every country was looking to solve this problem. So all our favorite developed nation partners, they all had their backyard to sort out. And African leaders have stepped up to the plate in terms of finding solutions at political leadership, including galvanizing domestic resources, like, for example, the funding of the African Union to begin to procure vaccines for the African country and setting up the mechanism. My colleague Joy mentioned the acceleration of the Africa CDC and the leadership it has taken in not only just looking at data and how we use it, but also everything from us beginning to manufacture our own PPEs to even putting in a supply mechanism and a financing platform to buy COVID-19 vaccines as we were negotiating with Gavi. That has given me hope. It is possible for us as an African nation to sort out our own problems. And I think our political leadership get it. And I truly hope we can all be behind them. I hope we pray they sustain the momentum.
Excellent, Bridget. Thank you. Alima, can you match that momentum in your closing 30 seconds?
I don't know. That was so powerful, Bridget. I think my one reflection is, for really strong political leadership to be really meaningful, I would really encourage political leaders to involve communities in decision-making. And I think that's hugely important. It's something we've kind of tangentially touched on, but hasn't been at the heart of today. But if we involve communities, it means that we're more likely to have solutions that are accessible, that are inclusive of all parts of society across all of Africa. So I would really encourage involving communities.
Excellent. And we started with Joy. I'm going to end with Joy. What do you say? How do we connect all these dots, especially when it comes to leadership?
I think the most important lesson that we are learning now during this pandemic is that leadership is at all levels. Community leadership is just as important as leadership at the top, at head of state level, or even at continental level. That all leadership is absolutely necessary and needs to step up to the plate, whether it be religious leaders, whether it be private sector, and whether it be the teaching community, the research community. And the challenge, I think, that COVID-19 has posed to us is whether we have the ability to work together, whether we have the ability to use the limited resources that we can in a clever and strategic way in order to maximize the outcomes and the output that you can get from them. And 2021 is going to be even more challenging than 2020 because we'll have less resources, even less resources than we had last year. So, and there is a vaccine nationalism all over the globe. So the first 6 months of 2021, we have to get Africans on vaccines, but they are not available because they are being ordered. So I think there is a huge opportunity here to show the benefits of partnership and of collaboration, and for African leaders to work together with their communities, with their leaders, and with their private sector to actually make a difference. And like the other speakers before me, I am very optimistic that if we all pull together, whether we are young people, whether the private sector, media, we can actually get this job done, and done impressively.
Wonderful. Well, you certainly met the bar for enthusiasm, energy, and foresight, which is excellent. That's what we wanted to get to in this particular session. So let me thank you all, Joy, Alima, Bridget, Abdurrahman, Saban, Jennifer, and Constance. Thank you very much indeed for a wonderful discussion. Thank you to the participants.